What if a common infection could spiral so fast that your organs begin to fail? And if you have type 2 diabetes, your odds of that happening are doubled.
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at sepsis, how it develops, why type 2 diabetes magnifies the danger, and what you can do now to cut your risk.
I'm Alara Sky. Sepsis is a life-threatening organ dysfunction triggered by a dysregulated response to infection. In the U.S., over 1.7 million people develop sepsis each year, and about 350,000 die. Globally, 350,000, it's involved in 1 in 5 deaths. Those numbers make early recognition and prevention essential.
Sepsis often starts with everyday infections, UTIs, pneumonia, skin wounds, or mild intestinal infections, and most cases actually begin outside hospitals. The overreaction unfolds as immune cells release cytokines. If that release becomes excessive, the blood vessel lining turns leaky, blood pressure drops, microclots form, and organs are starved of oxygen. Without rapid care, this can progress to severe sepsis and then septic shock.
You can remember key warning signs with time: temperature higher or lower than normal, signs of infection now or recently, mental decline like confusion or unusual sleepiness, and feeling extremely ill. Another memory cue is sepsis: shivering or fever, extreme pain, pale or clammy skin, sleepiness or confusion. I feel like I might die, and shortness of breath. If several appear together, seek medical help immediately.
A large Australian community study tracking adults for up to 10 years found that people with type 2 diabetes were twice as likely to develop sepsis as matched controls. Risk wasn't uniform. Adults aged 41 to 50 with diabetes had a 14.5-fold higher likelihood, and men and those of Aboriginal ancestry were disproportionately affected.
The study also identified modifiable factors within the diabetes group. Current smoking raised risk by 83%. Higher fasting glucose, insulin use, elevated resting heart rate, neuropathy, cerebrovascular disease, and elevated NT-proBNP each added vulnerability. The message was clear: tighter infection monitoring and prompt treatment save time that sepsis tries to steal.
Why does diabetes set the stage? Chronic hyperglycemia blunts your immune defenses at multiple levels. Neutrophils move less effectively and kill pathogens less efficiently. Opsonization is impaired, and antibody balance shifts insulin resistance and inflammation, also injure your endothelium, and slower circulation, plus neuropathy, can delay your awareness that a local infection is brewing.
You can lower risk by controlling glucose consistently. Keeping levels steady improves white blood cell function and wound healing. Evidence shows that better surgical outcomes track with tighter glucose control, and while community data are mixed, the overall pattern supports stability as protection against infection and sepsis.
Start with diet. Clearing refined sugar and eliminating industrial seed oils such as canola, soybean, sunflower, safflower, grapeseed, corn, rice bran, cottonseed, and vegetable oil blends helps restore insulin sensitivity. To guide your choices, avoid items from the expanded list that add excess linoleic acid or come packaged with refined flours and additives. Store-bought baked goods, most dairy alternatives, nut and seed butters, common nuts and seeds, chia and flax products, soy products, frequent bean or legume-based meals, chicken and pork from high PUFA diets, and alcohol.
As you remove those inputs, include foods that support metabolic health and steadier glucose: butter and ghee, eggs, tallow, dairy fat like raw cheese or raw milk, coconut oil, dark chocolate, bone broth, collagen or gelatin, ground beef or bison, gelatinous cuts like shank, cheek, oxtail, and porkhock, well-cooked vegetables, in-season ripe fruit, white rice, masa harina, sourdough bread, occasional well-cooked beans, maple syrup or honey, organic sweet orange or grape juice, well-cooked peeled potatoes or sweet potatoes, beets and turnips, and quality cassava flour.
Reintroduce carbohydrates in a deliberate way. Cutting them too aggressively can raise stress hormones and erode muscle, which undermines insulin sensitivity. Using whole food carbohydrate sources, like fruit and white rice, provides steady glucose without driving that stress response, supporting healthier metabolism over time.
Reduce other metabolic stressors. Limit plastics and fragranced personal care products. Avoid heating food in plastic, and keep phones away from your body during sleep to lighten environmental load. Each small change reduces background cellular stress that worsens insulin resistance.
Physical activity belongs in your daily plan. Contracting muscles draw glucose from your bloodstream, reducing the burden on insulin. You don't need extreme training. Consistent, moderate movement like brisk walking, cycling, or swimming improves sensitivity and lowers post-meal spikes.
Sunlight exposure supports insulin function and mitochondrial energy production. Build in daily time outdoors. If you've had a high seed oil intake, allow months of lowering those fats before extending midday exposure, since linoleic acid heightens sunburn susceptibility.
Track progress with the HOMA-IR test to spot insulin resistance early. Use either formula, fasting glucose milligrams per deciliter times fasting insulin micro-international units per milliliter divided by 405, or fasting glucose millimoles per liter times fasting insulin micro-international units per milliliter divided by 22.5, a score below 1.0 reflects healthy sensitivity. Higher values indicate resistance. Monitoring trends helps you see whether changes are working.
Address infections promptly. For UTIs, about 90% driven by E. coli, D-mannose is a supportive option, and methylene blue offers a gut-friendly alternative that concentrates in the bladder. Work with a clinician, especially if symptoms persist. Keep skin wounds clean, covered, and watched for redness, swelling, or discharge, and avoid habits like nail biting that create microbreaks.
Manage chronic conditions tightly. Keeping blood sugar, blood pressure, and kidney markers in range lowers baseline risk from severe infections. At home and after hospital stays, practice strict hand and surface hygiene, and use sterile technique for dressings and devices to limit exposure to harmful microbes.
If sepsis does occur, vitamin C-based therapy under medical supervision can be life-saving. A 2-day protocol combining intravenous vitamin C and thiamine with hydrocortisone has been reported to sharply reduce mortality in severe sepsis, with vitamin C and hydrocortisone helping restore endothelial function and thiamine supporting vitamin C metabolism and correcting common deficiencies.
Here's your challenge. Starting today, remove industrial seed oils and refined sugar from your meals for 2 weeks. Choose from the metabolic supportive foods we listed. Take a daily 30-minute walk and schedule a fasting blood draw to calculate HOMA-IR within the next month. If you notice infection signs, especially those in TIME or SEPSIS, seek care immediately. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.